Good morning, colleagues and friends from the globe everywhere. Good morning, or afternoon, evening, or whenever. It is my great pleasure today to have an opportunity to share with my perspective with regard to the role of TGF-β in this COVID-19. My laboratory has been interested in TGF-β in regulating the immune response for quite decades, actually. We focus on TGF-β regulating immune response and inflammation, so on and so forth. This cartoon actually is basically a very simple cartoon to illustrate how TGF-β signaling. We know that TGF-β is basically secreted as a latent protein, and it has to be activated in order for TGF-β to bind their receptors to signal through different pathways. I'm not going to detail for that pathways. However, I would like to mention a few points here. First, we have to remember TGF-β, mainly in the latent form, can exist in our blood. Normally, in the normal people, we have 40 to 80 nanogram per milliliter of latent form TGF-β. This is not working activity, but it is there. And the TGF-β can be expressed in all the cells or produced by all cells and the tissues. And TGF-β receptors can be expressed in almost all the cells in the body. And as said, TGF-β needed to be activated in order for a signal transduction. TGF-β in the human diseases can be a good, bad, even ugly. Now, back to February, actually, even earlier than February, because of these COVID-19 diseases exploded in the world, I had some kind of the idea before in 2003 when the first SARS occurred then in China. I thought the TGF-β might be important factors in this disease, in the pathogens for these diseases. Therefore, I wrote this hypothesis or kind of proposal to lay out the rationale why I'm thinking that TGF-β is important, give my hypothesis and theory, and I even proposed whether we could manipulate TGF-β treatment for the COVID-19 patient, especially the severe late stage for the patients with this disease when all the other options of the treatment was exhausted. Afterwards, Dr. Wang Trip from that company called me. We had a very nice discussion because in his company has some compound working, TGF-β blocking compound working the human immunology. He thought this is a good idea too. We had a very active discussion. We thought maybe we should work together to do something for the sake of the patients. This slide shows you the some common feature and problem of this COVID-19 patients. I summarized here. We know that COVID-19 can be symptomatic or minor or moderate diseases or even severe pneumonia or the family diseases. And there's quite different abnormal immune responses and inflammation in these patients. For example, in the blood, people normally see the so-called cytokine storm increases in different pro-inflammatory cytokines such as IL-6, IL-1 beta, TNF-alpha, so on and so forth. Interestingly, though, these patients normally have a decreased proportion of lymphocytes, especially T cells. And then, though, if they have some increase of the frequency of the TH17 cells, this is a type of pro-inflammation cytokines. It is always almost that the neutrophils increase not only in the blood, maybe also infiltrating in the lung. Interestingly enough, besides the increase of the IgG, normally you can see this COVID-19 patients have increased the IgA. In the lungs, we see a massive infiltration of the neutrophils, macrophages, increasing IgA, and of course also cytokines, including there's some evidence starting to reveal that TGF-β can be increased in the lung too. Now, we know that patient has unique, very severe problem. What is the dysregulation blood coagulation system? Normally the thrombus formation, which may be an important cause for the some patient death. And the cause of the COVID-19 patient death mainly can including two aspects. One is the so-called ARDS, which is acute respiratory distress syndrome, mainly caused by the acute pulmonary edema, maybe also the acute inflammation and the infiltration and cause the acute lung fibrosis too. And second part is the sepsis and the septic shock. That's the major cause for the death. Now, I would like to spend two aspects for TGF-β in COVID-19, which is probably the bad or even ugly part. The first part is the what and how does TGF-β affect during the pathogenesis for COVID-19. Second is where and how is TGF-β probably produced activated during this virus infection. The first part. Now, where this TGF-β and how this TGF-β affect the pathogenesis of the COVID-19 patients. As we know that COVID-19 virus can infect the airways, and then there's TGF-β can be increased. The TGF-β intake might be affected different aspects. I'll go through one by one. Most of them is already reported. Some is still question marker. TGF-β can increase the pulmonary edema. That is what's known. And TGF-β can induce lung fibrosis, maybe one of the most important factor. TGF-β somehow can also causes or increase the septic shock. This is still question marker. TGF-β can induce epithelial or endothelial cell death. TGF-β can increase the furin in epithelial cells, which is quite unique. TGF-β can be an important factor to recruit neutrophils and macrophages infiltration to the lung. On the other hand, TGF-β can be an important factor, maybe one of the most important factors to induce or increase IgA. This can be known for many years. TGF-β can increase the neutrophils in blood. TGF-β in tandem is the most important factor to inhibiting or suppressing the T cell proliferation, including CD4, CD8. Some report already show TGF-β somehow can actually directly or indirectly enhance more of the cytokine production, surprisingly though, paradoxically. And TGF-β is one of the most important factor, or essential factor for inducing the Th17. And another report says TGF-β can induce this protein called the TGF-β protein with this acetylation of this particular protein there. I'll give you a few examples. For example, TGF-β can increase the pulmonary edema. This ARDS is characterized by the hypothermia from flooding of the distinct air spaces of the lung with protein-rich edema float. And pulmonary edema, because of this increased lung vascular permeability, and also in the same time, the inability of the alveolar epithelium to remove the edema fluid from the air spaces. That's the cause of the pulmonary edema. In ARDS, TGF-β has been shown can reduce the alveolar fluid clearance, but in the meantime, it can increase this permeability, therefore can be important for this pulmonary edema. Second, TGF-β, as I mentioned, is one of the most important for the lung fibrosis. Maybe this also occurs during the COVID-19 patients, because we know this pulmonary fibrosis is one important feature for COVID-19 patients. The COVID-19 may directly lead to the development of pulmonary fibrosis through a direct consequence of virus-induced the cell death, or indirectly causes the consequences of the cytokine-mediated alveolar damage. A key molecular mechanism of the lung injury fibrosis is the activation of this TGF-β, and active TGF-β may recruit, activate, or even stimulate growth of the fibrosis. That's the important we have to keep in mind. And That's a very interesting, unique feature for this COVID-19. I found this paper published recently. I think it's quite interesting. I want to go through with you. We know that the original SARS in 2003, they use two receptors. One is ACE, another called TMPRSS2, standing for this protease. However, this is SARS-CoV-2 virus, which is this virus for the pandemic, uses three receptors. Besides these two, AC2 and TMPRSS2, also this virus uses furin, very unique, very unique. And the TGF-β, though, can do something very uniquely. TGF-β does not affect the expression of the CE2 and the TMPRSS2. However, TGF-β can enhance or increase the expression of furin from these cells, human epithelial cells. This in turn, though, we know furin is one of the most important factors to active latent form TGF-β become active TGF-β, which may be forming a very devastating positive loop there. Another one is recently published too, which is a quite interesting protein too, called TGF-β IP K676AC. This can be a marker in the blood as the severity of this COVID-19 patients. Basically, what they found was that this so-called escalated the K76, sorry, this is a typo here, 676 TGF-β-induced protein short for this one. It is significantly increased in severe COVID-19 patients. They show that TGF-β can upregulate this protein. Importantly, this protein can become acylated by this CBP and the P30, which is the very important factors. In this report, they also showed very strikingly that this protein can activate NF-κB, which induced more of the inflammatory cytokines, including these so-called cytokine storm cytokines. And this is the data they showed there. You can see here, this protein, they compared the normal people with the patient with light disease without ICU or patient with severe disease. You can see here, this patient with ICU have significantly enhanced the expression of these proteins, which suggests there's something going on here. This is the second part I want to share with you is that the production and the activation of TGF-β, how this TGF-β is produced, activated during this COVID-19 infection, which I summarize here again. We know that, that as I mentioned, that TGF-β, in order for TGF to work, TGF-β must be activated by different mechanisms. We know so far, this is most of the reported already. Actually, this COVID-19 virus, their S protein can directly bind the integrin, which is including alpha-5 beta-6 or alpha-5 beta-8, which express the epithelial cells and immune cells, which are important factors to activate TGF-β. And this virus can also cause the imbalance of the so-called RAS, which is virus ACE, this agonist 2 axis, which is important. As I mentioned, this TGF-β may actually enhance the furin, but the furin, though, is one of the important factors, together with the other metrics such as MMPs, RS, be an important factor to activate TGF-β. And the neutrophils itself is an important source for store and the release of the active TGF-β through their, for example, aspartate. And another part I want to mention is probably is very important. When virus affected the patients, they cause these different cells death. If these cells become apoptotic, they can be engulfed and digested by the macrophages, which in turn can produce TGF-β or active TGF-β, which is quite important. We have to remember fibrolysis is very important for the TGF-β production too. On the other hand, for example, the ROS inflammation can be important factor for activation of TGF-β. And as I mentioned, this core-90 patient has a very unique symptoms, which is the coagulation problem, which is platelet activation. Platelet activation is probably one of the most important factors to activate TGF-β. We knew that for many years. And as I mentioned, TGF-β in the blood, we have this latent form there. And also another type of the cells, which is called neutrophils, myeloid-derived suppressor cells, can store or release active TGF-β. We know that several factors can be the risk factor to enhance the severity of the COVID-19, including the type 2 diabetes or obesity, whenever. Now, why the high glucose can be his risk factor? Because of time, I'll give you a few examples to illustrate that. As I mentioned, this is a well-known phenomena that when the cells become apoptotic, they can rapidly engulfed by these phagocytes, especially macrophage in the body. This phagocytosis in turn can produce several of the immune regulatory cytokines we call. One important one is TGF-β. They do not produce very much of the inflammatory cytokines, but TGF-β is important. If, for example, in the COVID-19 patients, if this virus causes the death of these pneumocytes or epithelial cells, endothelial cells, or immune cells in the lung, if these cells die because of apoptotic, you can imagine that TGF-β can be produced or enhanced or activated. So another example is that—
wind up. Do you want to just do some final thoughts?
Okay, I want to see here, which is important for this. The final point I want to make here is that why the high glucose can be an important factor for COVID-19 severity. We think that diabetes, maybe this high glucose can make more of the TGF-β activation, therefore maybe an important factor. Thank you.